record, and then end it all. All right, good afternoon, everybody. Today's seminar will be on the role of using medical marijuana for the treatment of movement disorders. Those of you who just entered into our session, please keep yourself muted for now. And there'll be opportunities to ask questions at the end. I'd like to introduce myself. My name is Brian Kopell. I am a neurosurgeon at the Mount Sinai Health System, director of the Center of Neuromodulation. I also have a secondary certification in anti-aging and senolytic medicine. My colleagues today, I am being joined by Dr. Fiona Gupta, MD. Could you wave, Fiona? And Dr. Katherine Leaver, MD. Both of them a movement disorder specialist that will weigh in today on this very, very timely topic. Let me start by giving you a small presentation from PowerPoint, and then we can ask some questions and have a interesting discussion regarding this potential therapy. So, as I said to you, welcome to Medical Marijuana and Movement Disorders. During this presentation, you can email questions to that Gmail address, and we can field those questions, or using the chat box in the Zoom program, you can send a chat question to Fiona Gupta, Dr. Gupta, who will also field questions. This will be posted afterwards on Facebook and Instagram, and you can follow us and our program in these various social media mechanisms that you see here. As I said before, my name is Dr. Brian Kopell. I'm a professor of neurosurgery, director here at the Center for Neuromodulation at the Mount Sinai Health System. My practice is focused on treating patients with movement disorders. I also am certified in anti-aging and senolytic medicine. Dr. Fiona Gupta, my partner and colleague in the program Center for Neuromodulation, is a movement disorder neurologist. And Dr. Katie Leaver, also an expert in movement disorder neurology and a certified prescriber for medical marijuana. How to view this presentation. It's really important that you go ahead and grab a piece of pen and paper so that you can write down questions that you may have during the presentation, because even afterwards you can email us with your questions and we will answer it for you in the future. If you're on your iPhone, you may get disconnected if you try to take a screenshot, and it will be available later today on Facebook and YouTube. Please follow us on Facebook as well as the YouTube channels. So let's talk about medical marijuana and movement disorders. Well, we all sort of colloquially know what marijuana is, but essentially marijuana is a combination of two major psychoactive and non-psychoactive compounds. The most common and powerful psychoactive compound in marijuana is something called tetrahydrocannabinol, or THC for short, and this is what the molecule looks like. The other major component of marijuana, as it is smoked or ingested, is something called cannabidiol, which is the non-psychoactive component, and both known as CBD for short. CBD and THC act like a push-pull mechanism. They act in antagonism to one another. So one counteracts the effects of the other, and the balance of these two chemicals results in the effects that we see with marijuana when it is used both recreationally as well as for a medicinal purpose. If you actually take a sort of a really careful look at what the literature says about what medical marijuana has done for Parkinson's disease as well as other movement disorders, if you look at the studies that are essentially controlled, where we design the study in such a way that both the patients and the measurers are blinded to what is going on so that there's no bias. Generally speaking, almost every double-blind study for marijuana in movement disorders has not really shown any direct effects on the movement disorder itself. This is one of the few controlled studies that are in the literature from 2004, 19 patients with an oral extract of THC and CBD. It was well tolerated with the 19 patients, but there were no significant effects on Parkinson's disease dyskinesias per se. A second of the major controlled studies that have existed out there is this study from 2014, 21 patients given an oral extract of just CBD for Parkinson's disease. Again, double-blinded controlled. Once again, it's not surprising that this is a well-tolerated substance by patients. However, there were no significant effects on movement disorder symptoms except for quality of life measures. Now, if you look at other studies that have been uncontrolled where the bias could still be there, where the patients know what they're taking or the measurers know what kind of substance the patients have gotten, there actually have been shown some improvements in motor symptoms as well as sleep disorder symptoms. So here are two of the more recent studies looking at this. Now, there are a number of other of these open label studies that have shown improvements, but again, until we really know from a double-blinded study, it's hard to say whether these positive effects are due to the mood enhancing and anxiety reducing aspects of this substance rather than a direct effect on the movement disorder disease itself. Now, why should medical marijuana work for movement disorders? So both THC and CBD work on receptors called CB1 and CB2, where THC is an agonist, so that causes these receptors to fire, and CBD is an antagonist, where it protects these receptors from firing. So remember what I said earlier in this talk, that THC and CBD exist in a push-pull relationship. That's the source of the push-pull relationship. And animal studies have shown that these receptors may have some dysregulation in movement disorders. So that's kind of the theory as to why this might be good for patients with movement disorders. Also, a curious finding, the most CB1 receptors in the brain are in the basal ganglia, which are the structures of the brain that are directly related to movement disorder diseases. And CB1 may protect against dopaminergic cell loss. And again, this comes from just animal studies. So this is kind of the reason why people are interested in medical marijuana, and specifically for movement disorders. So this is essentially all of my presentation that I'm going to have right now. I'm going to stop the share, and then I'm going to unmute my colleagues, and I'm going to ask them their thoughts in their own practice about marijuana for movement disorders. So let me start with Dr. Gupta. Fiona, can you give me your thoughts about what I presented and what you've seen in your practice?
Absolutely. Well, thank you so much. One of the reasons that this virtual seminar is so important is because, at least in my practice, it's probably the #1 question that I get asked by patients. And so I think your presentation was really spot on in kind of going over, you know, in a very nice way, just the underlying mechanism, and then the studies so far. And again, the studies have been small, but they do really hit home on Parkinson's disease. And what I mean by that is for all of us who treat Parkinson's, we know it's more than just motor, it's non-motor, it's sleep, it's mood, it's feelings and things like that. So, you know, it's interesting that the studies really hit on both the motor and the non-motor aspects. And I think, you know, in owing to our multidisciplinary care team at Mount Sinai, when it comes to movement disorders and being very forward on wellness, it's wonderful that we also have Dr. Leaver on, who's actually a certified prescriber. So I'd love to hear more from her angle, even about just logistics of when patients come in and how they basically acquire this. I've sent many patients to Dr. Leaver for different reasons, a lot of them being sleep, anxiety, tremor, or sometimes even, other types of motor symptoms like dyskinesia or dystonia. And patients are doing very well so far. Important to realize this is in addition to their underlying dopaminergic medication regimen, in addition to other treatments such as deep brain stimulation and other things. So it's not to this will not, necessarily take away the need for other medications.
Can I ask both of you a question? I'll start with you, Katie, and you can answer it afterwards, Fiona. Have you seen actual direct effects on the movement disorder symptoms per se? Let's take the anxiety, sleep, and non-motor symptoms of anything else aside. I'm talking about just the motor symptoms. Have you seen any direct effects? And number two, has that been profound enough in any way to impact how much of the dopaminergic medication that you've been having to give those patients? So I'll start with you, Katie, if you could answer that question.
Yeah, sure thing. So I've been prescribing medical marijuana now for about 2 years. So I have quite a lot of, relatively a lot of experience with it since it became legal in New York State. And to answer your question, I definitely have seen patients who report being able to lower their levodopa dose in response to starting medical marijuana. That being said, that's usually not the primary indication that I start medical marijuana. As you showed in the studies, the biggest result is going to be on quality of life measures. And so there's 4 things I talk to people about with medical marijuana being an indication. So number 1, anxiety. Number 2, sleep, difficulty falling asleep or maintaining sleep. Number 3 is decreased appetite, some weight loss, which can happen in some of our elderly patients. And number 4 is pain. And pain and anxiety and insomnia are not only parts of Parkinson's, but a lot of other movement disorders. So typically it's thinking about medical marijuana for those 4 indications. And then to my surprise, I've actually been seeing people with a motor response, but it's usually something I say is a variable thing, and we'll see.
Have you had to ever adjust people's medications as a result of the positive or negative effects from marijuana?
So I've only had to adjust people in a positive direction. I haven't had anyone with a negative experience to medical marijuana yet.
Okay.
Yeah, I absolutely agree. And I've had a couple patients that are, remember Parkinson's has many different facets. There's no 2 people that are alike. There are certain patients who are very tremor dominant. And the tremor really doesn't respond well to the conventional medications for Parkinson's, including levodopa. So we have gone the route of medical marijuana, and lo and behold, it really does work nicely to the point where patients are then able to taper or lessen their dopamine medication. And again, I think that's because it really wasn't that effective to begin with. I've seen that. Dr. Leaver and I share a few patients who were on pretty high doses of sleep medication. It's important to realize over 70% of patients with Parkinson's don't sleep well. They have sleep fragmentation. They're up through the night. They have the REM disorder, like you talked about. There's a lot of issues with sleep here. It's really a sleep disorder in itself. And, by the use of medical marijuana, many of our patients have been able to come off of the sleep medications that they were previously on for years, including, benzodiazepines, clonazepam, Ambien, you name it. So I've seen some really good benefit with med reduction, not just from the dopamine angle, but even for some of the symptomatic treatments for non-motor issues.
So I have a follow-up question. So one of the big areas where at least marijuana has a slightly better research record is in the realm of pain. And so as Dr. Leaver basically kind of alluded to, pain is a very fundamental component of many movement disorders, often due to dystonic symptoms that can exist in Parkinson's, as well as other dystonia conditions. How often have you guys in your previous experience prescribed opiate medication when the pain got that bad? And what would you do going forward now that marijuana is available in New York State?
Yeah, sure. Well, I really tried not to prescribe opiate medications in the past, given that we know long-term it can actually worsen neuropathic pain. But certainly using medical marijuana in place of opiates has been shown to be effective across a number of disorders, and it is one of the indications on its own for prescribing medical marijuana in New York State.
Yeah, I think that's a very good point. I mean, opioids are very, very much last line. And if I do prescribe, it's in conjunction with a pain management specialist. However, I think it's important to really look at pain in Parkinson's. You know, yes, dystonia, which is muscle contractions, can be very painful and they can occur head to toe, particularly in the limbs, or I have some patients that have axial dystonia in the neck area, but that can be very painful. But pain can also be very sensory, which means almost like a burning kind of neuropathy type pain that oftentimes diabetics get, but that actually can be a feature of Parkinson's, particularly when the medication wears off. So I've seen the use of medical marijuana for this, you know, kind of neuropathic type of pain also improves. So not just sort of the muscular pain, but also that the sensory type pain.
I have a question regarding, in your experience, by what mechanism do most patients prefer to take the medical marijuana? Do they prefer to smoke it? Do they prefer to take tinctures and oils? Do they prefer to eat it? I'm just curious what you found, especially in this particular patient population, what they you know, seem to do best with.
So there's 5 routes of administration, and that includes an oil or tincture that you just put under your tongue. There's pills or tablets. There's a cream, like a topical cream. There's a suppository, and then there's the vaporizing oil. That's where you take the oil and you can vaporize it. It becomes an oil that, a smoke that you can then inhale. And I've found that the majority of product that I recommend is the oil because it has the fastest onset. It works in a couple minutes, and then it only lasts for about 4 to 5 hours, so that if there's any mal effect, people don't like how they feel, it's sort of out of the system. It's easier to control. The vaporizing device is pretty much the same, but there's some concern about a vaping related lung injury. I'm sure people have heard about that with e-cigarettes, so I'm sort of hesitant to prescribe the vape.
So Katie, if someone comes to you for a prescription, what are the options for dosing in terms of what would they receive in which route of administration?
So, you know, we talk about all the time, you know, treatment's always individualized and tailored to the specific symptoms. The presentation that Dr. Kopell made, he talked about CBD and THC. THC is going to be more psychoactive. It's going to be more potent. CBD is a little bit more gentle. So they have some different uses, different properties. In New York State, all dispensaries are required to sell a number of different products that have a combination of doses for THC and CBD. So depending on what symptoms we're trying to target and who the patient is, I'll prescribe some ratio of THC to CBD. And it's sort of variable depending on, you know, how old the person is, if there's any comorbidities, how much medical or recreational marijuana they've tried in the past, and sort of like how potent we're trying to get this.
So it's, you know, it's interesting. You know, some of these tinctures, oils, they're sort of these artificial sort of estimates of the plant. You know, obviously it's a little sort of dicey for a physician to prescribe for somebody to smoke something, because we do know that smoking in general is not a great thing for your lungs. But have you noticed a difference in people that responds to the whole plant versus these tinctures and oils that have been distilled down? I'm just curious.
Can you clarify with terms of like, in terms of them being like tinctures that you would be prescribed or that you would get at a bodega?
No, like I'm talking about like at like that you would be prescribed. So the medically available tinctures of cannabis, you know, are sort of distillates of either THC or CBD. But we do know that the whole plant has all other chemicals in it,
Right.
yet to sort of characterize more fully. And so one might expect that if you ingest the whole plant, that the effects might be slightly different than what we give to patients based on just THC and CBD alone. And I'm just curious, in your sort of anecdotal experience, have you noticed any effects or differences in that regard? Like, did a patient say to you, hey, if I smoke, the plant, I notice that I do this, but if I just take the pills or the tinctures, it is, or it better or worse, have you, that kind of thing.
Right. Oh, I understand. Yeah, that's a great point. I mean, medical marijuana we talk about is just two compounds, CBD and THC, whereas there's over 90 different marijuana components. So the issue that I see, the confounding issue, is that when you are taking the whole plant, usually people who smoke or take an edible, the amount of THC they're getting far exceeds the amount that's in the medical marijuana prescriptions. That's usually why people don't, get high on medical marijuana, because the level of THC is so low. So yes, people often have a different experience taking medical marijuana versus smoking it recreationally, but I don't yet know how much of that is because of all the compounds versus just the dose of THC.
Good point. How about you, Fiona? You want to comment on that?
No, I think I agree with Dr. Leaver. It's hard to kind of, dissect the formulation, and I kind of leave it up to her to be able to dose, but I do agree on that premise. That's very interesting.
All right, I'd like to ask, again, my movement disorder colleagues. Number one, how often do patients ask about this, and ask about it as a person who's never ever tried marijuana before in their past? And number two, where do you see this going for movement disorders going forward?
Well, as I had mentioned earlier, it's the number one question I get asked in my practice by far. Patients are learning about it through family, through friends. There's a lot of kind of information like floating around, so I think doing seminars like this are really important to be able to kind of ask experts and really, give accurate data. But it is a very commonly asked question, typically brought up by the patient or loved ones. And I think that's just because there's a lot of buzz between medical marijuana and other neurological diseases, especially, the use in epilepsy and seizures and things like that. So rightfully so, I think there is a place, and the question is asked very, very commonly. And I'm grateful that we have resources to then be able to send patients to.
Yeah, I would say that the majority of my patients actually have not done any marijuana before inquiring about it. I think it's becoming a growing awareness that this can be something that's helpful, that doesn't have to be stigmatized. And I think it's really going to be beneficial moving forward to learn more about the dosing of the THC and the CBD, because right now we're still working in sort of broad categories of like low dose, high dose. And so I think going forward, I'd like to have more control over that.
Yeah, I love that point too about not being stigmatized. I agree. Majority of my patients have never, used marijuana before and are a little bit reluctant to bring up the topic. So I think, to really destigmatize is very important. This can be part of your care, and it can be a great adjunctive therapy for the right symptoms. What struck me as very interesting is when you look at the data, for the amount that this question is being asked, our physician colleagues really have little awareness. I think there was a study that showed only, up to maybe 10-20% of physicians really know how to answer that. And only about 11% of our neurology colleagues have even, tried to prescribe or referred patients. So I think also there's a lot of room to grow, but it also needs to be done on the physician side, more awareness, more education, more teaching.
Well, yeah, I mean, I think, people have to remember that marijuana is still a Schedule 1 drug by the DEA classification, and Schedule 1 implies or explicitly says that these are substances that have no, quote, medical use. And so we're living in a very weird position now where the emerging scientific data is now in contradiction with governmental policy that we're still trying to work through. And I think that barrier in of itself can sometimes prevent communication, if you will. I'm going to now, since we've been talking for now 30, 40 minutes, I'm going to open this up to questions of people right now. If they have any questions, please send via a chat function. If not, like I said, you can email the following question. I'll send up the screen again so that the Gmail address, you can send your questions in the next several hours. So just checking right now to see if there are any questions whatsoever. Okay, maybe people right now are just need to think about it, or maybe hopefully that we were able to shed some light on this. Katie or Fiona, do you have any parting thoughts regarding this topic before we break?
Yeah,
I'm sorry.
oh, go ahead.
I'll let you have the last word, especially because you are our certified prescriber. But again, I think this is a great start. I think having this on a regular forum so we can update, maybe get more into the literature. Obviously more studies are needed. But again, I think, Brian, through your presentation and your words, that communication aspect is really, really crucial. So breaking a lot of the barriers there. But thank you.
Katherine?
Yeah, and I would just add that it's growing as a resource, as a way to treat many symptoms of Parkinson's disease and other movement disorders. And I would, encourage patients to bring it up with their providers to see if it might be something that they want to think about. I'm happy to provide consultation to anyone who, has any interest in learning more or hearing if it could help their symptoms. And we can put, if you send an email to the Gmail address provided, we can give you information on how we can set up an appointment.
Okay. Let's see here. And so, okay, so in conclusion then, this has been medical marijuana and movement disorders. I want you to take a look at this. Oh, we have a question. Let's take a look. Hold on. This is a question from Natalie. In your studies, have you found that certain styles of marijuana have worked more effectively, such as indicas, sativa, or hybrids? Just curious for my father.
Yeah, and so because of the way that medical marijuana is prescribed, we don't necessarily have the option of specifying indigo or sativa now. So I haven't been able to get enough experience with that to say from my clinical experience. And I think that similarly, the studies are so preliminary, they really only have just used, all THC, all CBD, and that's as much as it specifies. But I'm certainly interested in this topic. And a resource that I often rely on is once you are certified for medical marijuana, you meet with a pharmacist at the dispensary, and they provide sort of an additional layer of information. And I've often found them to be an excellent resource to talk through some of these other more high-level questions.
So just to sort of contextualize what Natalie said, indica and sativa are two subspecies of the cannabis plant. There have been all sorts of different properties of indica versus sativa given to these plants over the years. People swear that one is more stimulating versus one that's more good for pain and sleep. There was recently actually a study looking at the genetics of these plants. And what was surprising was that the differences between indicas and sativas are essentially nothing. That it really comes down to individual plants, essentially composite of THC versus CBD levels that are the results of the differential effects. So what's interesting is that, there's an example of science shedding some light on some sort of common dogma about this. So I think it really has more to do with the THC and CBD properties, at least right now. Of course, all of those 88 or 87 different other compounds may be at play here, but the genetics suggest that there's very little difference between indicas and sativa. Chris iPhone on our presentation asked about what about CBD alone. Katie, Fiona, could you talk a little bit about just using CBD?
Yeah, CBD is alone, I think, is a great option for certain individuals who are trying to avoid any psychoactive component at all. It's certainly the most gentle, benign form of medical marijuana and can be safely introduced in anyone. I think that it is most helpful for some anxiety and maybe a little bit of sleep initiation. Certainly in people who are elderly, I go for that all the time. The one thing I think that is confusing is why can you buy CBD, at any store? And that's because that CBD that's legally sold is from hemp and not from marijuana. So when you get a prescription for medical marijuana and you get CBD alone, it is qualitatively different than buy at the bodega, in addition to being sort of a more of a pure and vetted substance rather than, they've done some studies and found that some of the stuff that's labeled CBD does contain pesticides. So I really don't encourage anyone to get it there.
Yeah, I was absolutely going to say that. I think because it is quite universal, I have patients come in and they have, they bring it in all forms, whether it's the gummy or, other methods of the oil of CBD. But I always say if that's something that you're interested in, talk to one of us so that we can refer you to the right, right person. I wouldn't go it alone just to try to get it in the community. And I agree with the preparation.
Last question, I think, before we break again. If you have any remaining questions, please do submit via the chat now. Otherwise, we will post the email account where you can send our questions in later. The last question is, do you have any DBS patients doing marijuana as well? Katie, Fiona, go ahead.
I think we both do. I mean, there's no contraindication or interaction with DBS to my knowledge.
And I asked a follow-up question on that. Because only a subset of movement disorder patients opt to have DBS for whatever reasons, we don't have to get into that right now, but do you notice a differential in terms of accepting or being interested in medical marijuana amongst the DBS patients versus not?
That's a whole psychological aspect. It's a very interesting question. But, I will say, and, DBS is all of our passions in so many ways. And that when patients really go through DBS and they have that successful outcome, I do think they are more open-minded. So I would say, that's something we can probe a lot more into with our colleagues. But I would say, in my mind, I could answer that maybe yes.
I agree.
Share my screen as we break. Oh, there's another question. Stereotypically, marijuana can cause lethargy and changes in cognition. Do you notice changes in other parts of POC, such as exercise program or medication management plan of care, in terms of exercise or medication management with the use of medical marijuana? Good question. How does that impact the more physical aspects of patients' care plans, guys?
Yeah, that's great. And certainly, lots of people who have had experience with an edible know that it can really sort of wipe you out. So in terms of trying to avoid the sedating side effects of THC, I typically start with a lower dose and have found that at low doses, THC doesn't produce such significant lethargy and impact, people's exercise regimen. The other thing to do is to start it at night or in the evening after people have exercised during the day. And then over the next week or so, people's bodies kind of habituate to that sort of sedating side effect, and they're able to tolerate more doses during the day.
Yeah, I think that's such a great question, particularly because, exercise and movement is crucial for our patients, both physically and mentally, for their well-being. And I think this is another example of don't go it alone. You know, each patient is individualized, as is their medical marijuana regimen. So have that conversation, as Dr. Leaver mentioned, we discuss dosing, times to take it, preparation, and really, you know, the biggest thing though is to keep our patients active and well with optimal quality of life. So really, it's used in conjunction with programs.
Great questions all about it. Very interesting topic, obviously very timely topic. You know, people are really quite eager for expanded options for care in their lives. I'm going to, again, in conclusion, thank everybody for joining us this afternoon to talk about medical marijuana and movement disorders. Here is the Gmail address to send any further questions. We will have them answered. And please follow our program on social media. These are the various different social media accounts that you can tune in to our content now and in the future. So again, thanks very much, everyone. Have a great afternoon, a beautiful day here in New York City, and we will see you soon. All right, take care. Bye.
Thanks, doctors.